Hello everyone, welcome back to my channel. I am Annapuneshwari Parit, first year CSE student of Shri Venkateshwara College of Engineering, Bangalore. And I am up with a new concept that is preventing and fighting against diseases for a good health. Let us begin with process of infections and the reason for it. Disease versus illness. According to this way of thinking, disease is something that need to be cured, such as infection, injury, toxic exposure, cell degeneration, etc. Illness is something that need to be managed, such as pain of feelings of a pain, discomfort, distress, weakness, fatigue, etc. Germs according to CDC. CDC means Center for Diseases Control and Prevention. Germs are part of our everyday life and are found in our air, soil, water, and in and on our bodies. Some germs are helpful, other are harmful. Many germs live in and on our bodies without causing harm, and some even help us to stay healthy. Only a small portion of our germs are known to cause infection. Three things are necessary for an infection to occur. Those are source, susceptibility person with a way of germs to enter the body, transmission. Let us go through the source of infection. A source of infectious agent or a germs are referred to a virus, bacteria or other microbe. In a healthcare setting, germs are found in many places. People are one of a source of a germs including patients, healthcare workers, visitors and household members. People can be sick with the symptoms of an infection and are colonized with the germs. Germs are also found in the healthcare environment. Reason for infectious for a, from sources. Dry surfaces in a patient care areas that are bed rails, medicine equipments, and tables. Wet surfaces, moist environment, and biofilms. The example for these are cooling towers, sinks, equipment such as ventilators. Indwelling medical devices, dust or decaying debris. This is the chain of infection. Susceptibility people for infections. A susceptibility person is someone who is not vaccinated or otherwise immune, or a person with a weakened immune system who has a way for germs to enter the body. For an infection to occur, germs must enter a susceptibility person's body and invade tissues, multiply, and cause a reaction. Transmission of an infection. Transmission refers to the way germs are moved to a susceptibility person. Germs do not have themselves. Germs depend on a people, the environment, or the medical equipment to move in a healthcare settings. Contact move germs by touching the eyes, nose, mouth, or a wound after contact. Spray and splashes occurs when an infected person cough or sneeze, creating droplets which carry germs short distance. These germs can land on the susceptibility person, eyes, nose, or a mouth and cause infection. Infectious agents come in many shapes and sizes. Categories include bacteria, viruses, fungi, protozoans, helminthises. Bacteria are the one-celled organism that can be seen only with a microscope. And viruses are much smaller than the cells. AIDS, common cold, genital herpes, influenza, milices, chicken pox, and the sniggles. Coronavirus diseases is also one example of a virus. Fungi. These are many variety of fungi and the people eat several of them. Protozoans are the single-celled organism that behave like a tiny animals and gathering other microbes for a food. There are many variety of fungi. People eat several of them. Example, malaria and toxoplasmosis. Helminthises. Helminthises are among the large parasites. Example, tapeworm and roundworms. Preventing infection and avoiding spreading infection through simple tactics. Avoid close contact with the people who are sick. Cover cough and sneeze. Don't avoid touching your face. Stay home if you are sick. Clean and disinfect surfaces that are touched often. Avoid contaminated food and water. Prevent contaminated medical equipments, hand washing, medicines, and vaccines, avoiding the contact with the body fluids of an infected, prevent infection by a sexual transmission. How to reduce risk for a good health? Be a non-smoker and avoid second-hand smoke. If one smokes, need to be get help to quit. Be physical active every day. Eat healthy foods. Achieve a healthy weight. Control your blood pressure. Limit your intake of alcohol. Reduce your stress. Be screened or tested regularly. Practice hygiene and remain social. Let us go through a chronic illness. Chronic diseases are defined broadly as conditions that last for 1 year or more and requires ongoing medical attention as well as a limit activity for a daily living. Example for chronic illness are heart diseases, cancer, diabetes, etc. What is the main cause of chronic illness? They are caused by number of different health factors resulting at simultaneously. They take some time to develop. They last for a long time and often lead to other health problems. How to maintain better quality of life in a chronic conditions are not cured completely. So looking after ourselves about a medical advisors, living healthy lifestyle and having positive attitude help in maintaining better quality of life. Thank you.